Hello, I'm Sarah Vanchevsky. I'm the data manager with CPCQC. And in this video, I'm going to show you how you will enter data for turning the tide for both the hospital aggregate data and the patient level data. And so first you'll need to come into REDCap, which is where we collect data for all of our QI projects. And the link you can bookmark is redcap.vumc.org. And you should see two different Turning the Tide projects, the hospital level data and the patient level data. These will each be submitted monthly, and they are both due the third Friday of each month for the previous month. I'm going to start with the hospital level data. You'll click here, and under data collection, you can go to record status dashboard or add edit records. I prefer the record status dashboard because here you can see all the data that has been submitted for your hospital in the past. And you can also see whether each of those forms are complete or incomplete. And that is a field that you fill in yourself, self-reported. I'll show you that within each of the forms. And I also will note that within the hospital level data, that's where you will also see the hospital readiness assessment. Here's the one for this year, time 1, 2026. And so you can fill that in one time at the beginning of the year as well. But primarily you'll use this to fill in your aggregate hospital level data each month. So when you come in here, you will simply click today, and that'll plug in today's date. It's kind of giving me a hard time because I'm working from an old record. Let me actually go back and let's see what this one looks like. Filled this one in just the other day as a demonstration, and it's just giving me a hard time because it's expecting this to say today's date. I'm going to go ahead and change it. There we go. And we are filling in data for, let's say, January 2026. We are going to fill in the number of patients admitted for birth and the total number of newborns delivered during that period for which we're reporting, which is the previous month, January 2026. And then we will also break this down into the patients admitted by race. We do have an updated set of race categories this year that is much simplified compared to last year. And this is based on OMB recommendations and also aligns with what hospitals have informed us is reportable from their EHR. So the new categories we have are American Indian or Alaska Native, Asian, Black or African American, Middle Eastern or North African, this one's new, Native Hawaiian or Pacific Islander, white, other race cannot be categorized above, patient declined or refused, and finally not documented or unknown. And then we're also going to break out the patients admitted by ethnicity. Hispanic or Latino, not Hispanic or Latino, patient declined or refused, not documented or unknown. One other note I have about race is that for patients that are more than one race, you can simply count that individual in each race category. So these may not add up. They may exceed the total number of patients admitted for birth. Finally, we have primary insurance type for patients admitted for birth, Medicaid, Medicaid plans, private, other public insurance, and uninsured. The reason we're collecting all this information, and we know it can be hard to gather it, is that these will be the denominators when we look at the disaggregated number of patients screened for substance use disorder by each of these identities. And it really allows us to see if we are screening equitably across these different groups and to track that over time. Then we get into the substance use disorder screening as well as some other screens where we ask about the total number of patients screened for substance use disorder during birth admission using a validated screening tool. You can see an example set of validated screening tools here, which links to a Google Drive folder. We also ask about the total number of patients screened for depression and anxiety. And then we break out, just for SUD screening, the number of patients screened by race, by ethnicity, and again by payer. There is some logic built in here such that any of these screens cannot exceed the number of patients admitted. So if I try to put that 6 American Indian or Alaska Native patients were screened for SUD, I get a warning that that number should not be outside of the range of 0 to 5. 5 was how many were admitted. So there's a little of that logic to try to ensure that we don't accidentally put in that more Asian patients were screened than were admitted to the hospital. Finally, we ask the total patients who screened positive for substance use disorder. And notably, we are only counting patients who screened positive for a substance other than cannabis, alcohol, and/or nicotine. So if it's one of these substances exclusively or some combination of these exclusively, we do not include them in this count. It's outside the scope of this project. Optionally, we can report the number of patients who screened positive for these substances if we want to track that at our hospital. Finally, some additional screenings that are optional is the number of patients who were screened for ACEs and for social determinants of health. And lastly, we can mark this form incomplete, unverified, or complete. This is a REDCap field that's included in every project. If you feel like it's been filled in, which this one has not, if these are kind of missing or there's no data here, it should be a 0. So really all of these fields ought to be filled in with something before we would mark this complete. So I'm going to call it incomplete. I don't really see people use unverified very often. I could see using that if you would like to have this form checked by someone else at your hospital who's on your data champion team. And this is going to give the record back in that record status dashboard a green little bubble if it's complete or a red one if it's incomplete so that it's quick to find. And that's it. You're going to save and exit the form. There will be a warning that comes up telling me that there's some blank fields in here that ought to be filled in and are called required, but you can still ignore and leave record. You don't have to fill them in, or you can click OK and go fill them in. It's just trying to make sure that the record is complete. That is the hospital level data that you will do one form every month. And now I'm going to show you the patient level data, which is a separate project. So under my projects, there's 2 separate ones. And we're now going into the patient level data. Oh, and one last thing I do want to mention is that the hospital level form we were just looking at corresponds to this document that you may have received from your QI advisor. And this is optional. It's for you to fill in if it's helpful to get information out of the EHR and into this kind of format before bringing it into REDCap. But it's pretty much the same as this document, and you can transcribe that information into REDCap. So for the patient level data, this comes from this perinatal substance use clinical care checklist, which has also been distributed to your hospital. Ideally, this is used as a tool that follows along with each patient at birth admission and is used to basically manage their care and ensure that everything is being done for them to manage a substance use disorder. This is meant to be used for every patient at birth admission who screens positive for a substance use during pregnancy, again, using a validated screening tool, or who are currently prescribed medications for opioid use disorder to sustain active recovery. Again, we are excluding patients who screen positive for cannabis only, nicotine only, or alcohol only. And so when we go to submit our patients into REDCap, the number of forms that we submit, each of which are records, each of which represents a patient with a positive substance use disorder screen, ought to match in our hospital level data where we report the total patients who screened positive for SUD, it ought to match that number. So however many patients screened positive for SUD at the hospital level, that's how many individual clinical care checklists we should be reporting here. So when we click Add New Record in the patient level data, each form represents a patient. And we'll still put in the date we're submitting the data, and then the substances that were used during pregnancy, including those prescribed and not prescribed. And this question is the first one we ask in REDCap, because if the patient is exclusively using cannabis, nicotine, tobacco, or alcohol, that's basically going to be all that you need to respond to in REDCap. That'll be the end of the form. So this is the basis of other questions that will arise. So if I say the person's only using alcohol or just nicotine, we're not going to get any further questions here. However, if they're using opioids, you'll see that other questions pop up that we want to know about the patient. So it's very much based on this. The order is a little different, like the substance use question comes first in REDCap, but it really perfectly aligns in terms of the content with this form. And so some hospitals will basically take these paper forms and copy them into REDCap. Others do kind of work with a data scientist or a quality person in their hospital to create some kind of automated report with the data that they can then fill in here. So we'll ask you about the patient, details around the date of delivery and the birth parent age, the gestational age, the birth parent's self-reported race, and you can select all that apply. Note that these have been updated to align with the same ones you saw in the hospital level data. The ethnicity, primary insurance, and primary language, and special circumstances that applied, number of newborns born to the patient, whether a plan of safe care was developed for the dyad, and then the clinical care provided to that patient. And this is really the heart of the quality improvement work that we'll be doing over our time together. So did the patient receive counseling on recovery treatment services during birth admission? Was the patient referred to recovery treatment services before hospital discharge? Was recovery treatment medication initiated during birth admission? Did the patient receive a consultation with social work or case management? Did the patient receive naloxone in hand before hospital discharge? And was a postpartum visit scheduled for the patient before discharge? And lastly, we also ask about the clinical care for patients who screen positive for opioid use or MOUD. We have some follow-up questions about whether they were counseled on MOUD prenatally or during birth admission, if they received MOUD prenatally or during the birth admission, if they were referred to outpatient MOUD treatment before discharge, and if they were discharged with a prescription to continue MOUD after discharge, or none of the above, which will clear your other selections. So you can select all that apply here. Finally, you can put any optional notes about the patient. Just please do not include any identifying or HIPAA protected information, such as their name, birth date, health policy number, or social security number, partner or newborn name, or patient addresses and contact information. So a separate form is required for every patient. If the form is complete, you can select complete for your own internal tracking. If you need to fill in additional information later, I would select incomplete. And to add another record, you can click save and go to next record. And if you're done, you have no more to add, save and exit the form. So because I haven't filled this in, it's actually going to be giving me quite a number of warnings saying you need to provide some values here. And for now, I'm just going to ignore and leave the record. So you can always come back to previous records. You can click back into them. I'll just say that each hospital has a unique 6-digit code here, and you'll always see that same number at the beginning. And then the records are counted simply numerically. So your first one you ever enter will be -1, and then -2 and -3. And in order to recall which one goes with which patient, you'll have to click on it so you can go in and revisit that record and see the information. But you can always go back in and update fields, add more data, edit data, etc. And you can always go back and add new records, even if they are a couple months old or a few months old. You can go ahead and add them in kind of after the fact, and we will get those incorporated into our data dashboards. So that is how you enter your data for Turning the Tide. I hope that this was helpful. If you have any issues with accessing REDCap or still have questions about your data entry, you can feel free to reach out to me at data@cpcqc.org. Thank you.